Hello, this is Andy Tofflin. I'm one of the marketing managers, and we're at ASH 2017. Dr. Rajiv Pruthi just delivered an in-booth presentation about APC-R versus Factor V Leiden testing, and he's been gracious enough to spend a couple minutes with us giving us a quick overview of the presentation he just delivered. Dr. Pruthi, could you give us a quick overview?
Thank you for the introduction, Andy, and thanks for the opportunity to speak. We talked about a very commonly ordered test, which is a genetic test called the Factor V Leiden test, and the cost effectiveness of doing direct DNA testing versus doing an initial screening test called the Activated Protein C Resistance Assay, also known as APC-R, and we looked at the overall cost effectiveness of one approach versus the other. So as a background, venous thrombosis is very common in this country, and a lot of physicians order the Factor V Leiden test because it happens to be the most common hereditary thrombophilia among the white population. So what we did was looked at the Medicare savings based on CMS reimbursement on whether individuals order the Factor V Leiden test first versus doing the activated protein C resistance assay first. Now, the APC resistance assay is a very sensitive screening test, and if it's normal, there's an extremely low likelihood that the patient is a carrier for Factor V Leiden mutation. So we were able to show that by doing the screening test first, one is able to save quite a bit of money per patient tested, as opposed to going to the Factor V Leiden test first.